This is Dr. Anil, consultant surgical oncologist, Prathimacancerinstitute, Warangal. We'll discuss about ovarian cancer in brief in the following headings like introduction, clinical features, investigation, management, and what are the protective factors and advanced treatments that are available. First, coming to the introduction, ovarian cancer is one of the most common gynecological malignancy after cervical cancer, and it is the fourth most common malignancy in India. And the risk factors of ovarian cancer are family history, which is associated with 5% risk of developing ovarian cancer in near future, and hereditary breast and ovarian cancer syndromes, BRCA1 and 2 syndrome, and HNPCC syndrome. These are the risk factors that are associated with ovarian cancer. So what are the other risk factors? Those are like nulliparity and elderly age at first pregnancy, early menarche, and late menopause are the other risk factors associated with ovarian cancer. So coming to the clinical features, most of the patients are asymptomatic at initial stages, hence this is called a silent cancer. So the most common clinical features at presentation are nausea, vomiting, abdominal bloating, fullness in the abdomen, and dyspepsia along with low backache. And if the cancer has spread to the other organs, it might lead to increase in frequency of urination, constipation or obstruction, and breathing difficulty or dyspnea. So coming to the investigation modalities, first and most common investigation that is done is ultrasound abdomen and pelvis, which will identify whether there is a ovarian lesion is a malignant or benign lesion. So malignant lesion will have a few findings like solid component, increased thickness of the capsule, mural stratification along with papillary projections, and free fluid in the abdomen along with ascites and omental and peritoneal nodules along with liver surface deposits. So the tumor marker that is most commonly useful in the diagnosis of CA125 is in the diagnosis of ovarian cancer is CA125, which is also elevated in few other cancers and other benign gynecological diseases. Other investigating modalities that are most commonly preferred are PET-CT scan and MRI abdomen and pelvis. So coming to the staging of the disease, this is mainly grouped into stage 1, stage 2, stage 3 and stage 4. Stage 1, the disease is localized to the ovary. Stage 2 to the pelvis and the pelvic organs. Stage 3 to the abdomen and abdominal lymph nodes. Stage 4 to the distant organs like lungs. So coming to the treatment modality, stage 1 and stage 2 ovarian cancers are mostly treated by surgery followed by adjuvant chemotherapy, that is chemotherapy that is given after surgery for stage 1C and above tumors. Stage 3 and stage 4 tumors are initially treated with chemotherapy followed by surgery and giving remaining cycles of chemotherapy after surgery. So what is CRS and HIPEC? CRS and HIPEC is done for advanced ovarian cancer and other peritoneal malignancies like pseudomyxoma peritonei and ovarian cancer along with appendiceal neoplasms and peritoneal mesotheliomas. So the CRS and HIPEC is nothing but removal of all the gross disease in the abdomen which is visible to our naked eye, and instilling chemotherapy which is heated to 41 to 43 degrees centigrade and placing it in the abdomen for around 90 minutes. So this is one of the most advanced treatment that is available for advanced CA ovary. And the other modalities that are useful in CA ovary are immunotherapy with bevacizumab and PARP inhibitors like olaparib and rucaparib. The radiation is usually not indicated in ovarian cancers. Coming to the preventive strategies and screening modalities. So screening is advised for all the patients with history of family history of ovarian cancer after 40 years of age, and the most common screening modality that is employed is transvaginal sonogram along with CA125 levels. So all patients with BRCA1 and 2 mutation along with family history should be screened regularly after 40 years of age. And preventive strategies include consumption of low fat diet and quitting smoking, along with some cases of tubal ligation and OCP usage, and stopping artificial ovulation, etc. can be used as a preventive strategies against ovarian cancer. Thank you.